All right, I think we're a bit early, but I already see some people trickling in. Just to check, you can all hear me?
Yes, I can hear you.
Ah, great, thank you. Well, let's just wait for a couple of minutes because it's 2 to 10, and then start off the course. But good morning anyways. Ah,
Morning, Marielle.
hey, it's good to see you.
How are you?
I'm good. How are you?
I'm okay. Yes. And ready
Ah,
for the new year now.
what?
Ready for the new year, the new academic year.
For sure. So for all of you, you can all see Jannes now. He's also your lecturer for this year, and he has 3 sessions for you, but joining in as well, so that's great. I'm gonna wait for 1 more minute and then start off. You have a different scenery, Jannes, than last time we zoomed.
Oh, yes, now we have to spread out. So, yeah, we have to spread out. I don't know if can you hear me well?
I couldn't hear you yet, so I'm gonna move closer to my internet if that makes a difference just in time, because I had this before. It's rare, but sometimes it works if I sit in my living room. So we'll do a little tour through my house.
That's nice, yeah.
Yeah, you can all see my kitchen, get to know each other. All right. Look. I'm quickly gonna get my coffee and my water and then we'll start. 1 sec.
Excellent. And good morning, everyone there. Like, I don't know if anyone wants to open their cameras, so it's nice also to see some faces and some activity, so it feels more live. But it's also fine if you don't want to. Excellent. Good morning, guys. Good to see your faces. Nice. Thank you. Oh, it makes a difference. It looks much better. And we've got many more people joining in, so we are almost ready to start. So because the two of us will be here, so we'll do a bit of an introduction. So it's nice in the first day, at least you see both of the lecturers that will be involved in this course. And then, of course, you'll continue with Marielle for the first 3 days, and then the last 3 days will be with me. So it's excellent. Now, Marielle, just to update you, so many of the students now turned on their cameras, so it looks really nice. So you can see all the faces rather than just
Yes, that's perfect. Yeah, I wanted to ask you that for this first lecture. Like, it's not mandatory to put your camera on because, you know, if you have good reasons, if your house is a mess or something like that, or you have a cold sore, that's okay. But you would really do us a big favor if you can, and if you will turn on your camera so we can see you. It is a bit different now for the last year, also for us. So for the interaction, it's just nice to see each other. So um, it comes as close as we can to how it usually is. But okay, so that's that. Then another thing, a practical thing that I want to mention is that feel free to speak up. You don't need to be quiet. If you have a comment, if you have a question, don't worry to just raise your voice and take the stage. Also, I'm going to try to see if we can get some interaction anyways. So I prepared a PowerPoint and I have some questions there that I will ask and pose to you and see what input you have to keep it interactive for the coming days. All right, so let's start off. I think most of us are there. Good morning, everybody, and Happy New Year. I'm quite excited to do this course for a couple of reasons. First of all, it's my first time to do it online. I've done this course a couple of times, but first time to do it this way. So I'm excited to see what we can do and how we can make it interesting and interact with each other and discuss the literature concerning healthcare management. I'm gonna go use a shared screen for my PowerPoint, but I'm gonna go off and on that and kind of see how it goes. I think the internet works well now, right?
Yes, much
Just
better.
checking. Yeah, I just wanted to check that. I had this before, and apparently this is a better location, so this will be my background for the coming days. All right, so now first let me share my screen with you and start off the first lecture. All right. Wait, let me put on the chat. So one second, I'm just putting the chat also on the side. So if you have any remarks, then I can see them. One sec, just let me get the chat and then we will be good to go.
There is also a question on the chat. So, well, will the lectures will be recorded or published?
Yes.
They will be recorded, and you'll have the recordings there on the canvas. So after the lectures, you can always go back and listen to the lectures once again, or focus on specific areas that you wanted to review and recall the content.
Yeah, exactly. Okay, good that somebody posed that question. They're all set up to be recorded automatically. So you can listen to them afterwards for sure. All right, now here we go. Welcome. The first lecture and the introductory lecture of healthcare management. Happy New Year, as I already said. I specifically had it happy and prosperous because it has been an interesting year. So I think we're all hoping for 2021 to be prosperous and maybe a bit different from how it was in 2020. However, for the course, as it's called Healthcare Management, we will discuss in more detail how the last year has been. Now, I will do that the first 3 lectures, and the last 3 lectures, Jans will do that, who you have already met now. So a little introduction. I'm a PhD at the Department Organization Studies. And I'm in my last year by now, just started the 1st of January, actually. So my research is in the healthcare context, and specifically I looked at innovations within hospital care. I have been doing field work in one of the hospitals in the Netherlands and looked at how the social process, well, let's say, influence or maybe even obscures implementation of innovation. So I used qualitative methods, looked at it from an organization science perspective, and see how that unfolds. Also, in addition, I've been a lecturer since I started my PhD, so it's the third or fourth time by now that I'm giving this course. In addition, I have taught some qualitative method courses and am a master thesis supervisor. So, Jannes, you want to introduce yourself now?
Yes, sure.
Yeah.
Yes, maybe that makes the perfect sense. So
Yeah.
good morning, everyone, and Happy New Year, and very healthy New Year for everyone. So as you can see there, that's my name, Yannis Kiratis. I'm an associate professor in organizational theory, and I specialize specifically in healthcare industry and healthcare management. So all my research, all my teaching has been in that area. I've moved to the Netherlands the last year and a half now. So before that, I used to be for 18 years in the UK, where I did most of my studies. The areas where I specialize in healthcare are in the institutional theory applied in healthcare. So what is the organizing logic behind the structure of different health systems, for example, or the different healthcare organizations, how they interact and collaborate, and what is the influence of these interactions on the people that work there, for example, different professionals like doctors. Another area of work is the innovation, which we share with Marielle. So it's the implementation and scaling of innovations, innovative technologies, new models of care, new delivery methods, and how do you make them available across health systems or across big parts of organizations, moving away from pilots and small areas where there's operational excellence. These are kind of the most relevant areas for this particular course. I also do some research currently that focuses on the embeddedness of artificial intelligence in radiographers, in radiology and nuclear medicine in the Netherlands across a number of hospitals. We've got also a current ongoing project on COVID-19, and it's a European funded project that we look at governance on crisis management, and I focus mainly on the healthcare part of that, and particularly I'm interested in the primary care, the role of primary care and the interaction with hospitals and public health. There's also some work that I'm currently doing that focuses on the professional role and identity of physicians, and especially physicians in primary care, that they have to change the way they operate and they interact with their patients and the other healthcare professionals, especially as looking at the current crisis, the COVID-19 crisis, as a catalyst for change in what they do, how they see themselves, and how they make their work meaningful. So these are the areas I've taught in many courses in healthcare management. I've co-founded some of the courses. I also co-founded recently a course that focuses on leadership, but this is tailored. That was at Cass Business School in London. That we tailored that course for senior medical professionals, so medical directors, associate medical directors, people with at least 15 years of experience. So for most of my teaching has been in the past and in MBAs or postgraduate students, but in the last year I've also started doing some teaching again on bachelor level students, which is also very refreshing, seeing the younger generation and remembering these early years of also my studies, which is also very refreshing. I think that's it for the timing. I'm not going to take any more time, and we'll have the opportunity to be together for the last three sessions. So you have Marielle for the first three, and then the last three will continue together. And the very final one, it will be the two of us wrapping up and reflecting on any issues, any knowledge or any clarification you would like to make on the final point. And just to reflect on one of the chat questions there, but from Dana. So there are 6 Q&A sessions but there's only one in the schedule. So the actual, what we decided to do with Marielle is that we are going to have the first two 45-minute sessions as kind of lectures where we're trying to cover most of the material, the teaching, the readings that you have and some of the key concepts. And then we left the last hour every lecture of every day to be more reflective. Q&A session can be incorporated there. That means the 6 sessions that we have corresponds to the 6 Q&A sessions that they are mentioned in the manual. I hope that's clear.
Yes.
Over
Exactly.
to you.
Thank you, Jannes. Yeah, that's exactly what I wanted to say. So as we will discuss later, we have shaken up the course a little bit from last year to make sure that it fits with doing it online. So we cut all the sessions in 3 sessions of 45 minutes because from former experience to have like 4-hour sessions like last year, it was, I think, 5 hours in a row per day. Your concentration just goes down, especially with listening on a screen. So we split it up with 50-minute breaks in between. And the last one will always be reserved to talk about the essay assignment that you will have to complete for this course. Now, I'm going to make a mix of having tips and tricks and talk a little bit myself the last 45 minutes. But also, I think I will try to work with breakout rooms and reserve time to reflect on how you can use the literature that we have discussed for your essay and leave room for any questions that you have or might want to discuss or pose to each other. All right, so will the Q&A also get recorded? Yes. I think everything is automatically recorded, so everything will be, you will be able to find online to check later as well. All right, so the course, it's 4 weeks. It's the last period of the minor. It's given by the Faculty of Social Sciences and it's multidisciplinary. You have all been following the whole seminar of healthcare management now, so you already had 2 semesters from a different perspective, and the last one will be given by us, and will provide you with a different angle on healthcare management. It is, and we know this from last year's, it's 4 weeks. And the last week, as it also is with courses of 8 weeks, is always reserved for whatever form of examination. For that reason, this is the first week of 3 weeks that we will have active lectures and Q&A sessions. So it flies by. It can be quite busy because it's also 6 ECSs that you will get for this. So it is quite intense, but it's all, I think, very doable because it's the only course you will have now. Now I have one question, also for me to see how much things will overlap with what you formally have. Maybe you can all answer in the chat now because it's a multidisciplinary course. So you're all from different studies. What study you are following at the moment? All right. Ooh. Right. Okay, I see biomedical sciences, health and life sciences, medicine, psychology. Oop. All right. Science, business, and innovation. All right. So is there anybody in the room who has or is studying anything in the social sciences? I see nods heading no, that's good.
Oh, there are some people, because there's some people I see that, you know, politics, philosophy, and economics, business administration. There's one in organizational sciences I could see.
All right, perfect.
But there are some people.
There are some, okay.
But the majority is health and life sciences, biomedicine, medicine.
Public administration and organizational science. Okay, good. Yeah, that I didn't see that as quickly, but good. Okay, there are some of you, but as you can see, not only the semester comes from different angles. Also, your fellow students come from a lot of different disciplines. So what we would try to do also in the Q&A sessions that we end the day with is see if when you are in breakout rooms to bring your own knowledge and bridge those disciplines. All right, so that's the course. So the first three, as I already have mentioned, will be given by me, and the last three will be given by Jannes. How it is designed is that, well, Jannes has introduced himself and has a very wide spectrum of knowledge of healthcare. For me, I also have knowledge about healthcare because my research involves in that, but I'm going to get more into the organization science side of things. So we start off with a bit more of the basics from social sciences and organization sciences, where Jannes will pick up and also apply his knowledge more and see how you can actually use these organization theories and social science theories to understand and manage healthcare organizations. So as you can see, therefore, his first lecture will be about leading and strategic management. So it will be more applied of what we discussed formerly in my lectures. We have changed a couple of things also that I want to talk you through quickly, because although we might, at least I am, all are a bit Corona tired, we thought we could not do the exact same course as last year, which was in January as well, when something like this, like a global pandemic, is going on. So what we try to do, and it will be a bit challenging, but I think it will blend in nicely, is that on top of that, you're going to get an introduction to, for most of you, the social sciences and organization sciences and how to apply that to healthcare. We will link it back to the current situation and what is going on. So it will be a mix of the theories that we did last year, and also see how this actually can be helpful and how these articles can help to enlighten us and see when something like this is happening now at the moment. So, although maybe a bit tired of how everything is now being in the lockdown, as all of you, it also, strangely enough, things come with silver linings, provides a unique opportunity to actually have such a dynamic situation at hand and see how we can use the theory to understand that better, and especially then how to manage and understand healthcare organizations within this context. Okay, so usually, and that is a thing we changed from last year, you would have worked in groups and done interviews with healthcare professionals and write a report about that. Now, I think due to practical matters, but also ethical, we changed the way we will examine you. Because sending you out there now to do interviews with healthcare professionals might not be the priority of all of us at the moment. So instead, you will write an individual essay where you will bring together the theory and the theories that we discussed and the literature and apply it to today's situation. All right. So this we already discussed. All the sessions are built up in 3 45-minute sessions. First 3 by me, last 3 by Jannes. And in the 4th week, we will have 1 session to reflect on how your individual assignment is going, and things that we can help you out with. Whatever questions you have, we will address. Right, so in this course, oh, 1 sec. I can see this now. You will be introduced to the theoretical approaches of social sciences, particularly in the field of organization studies, relevant to studying healthcare practices and organizations. Apply this theoretical perspective to analyze practical challenges, dilemmas, and problems in organization management of healthcare. The third one, develop and critically assess findings and implications based on such analysis. So how does this build up? We made it in a pointer of 3, is that the first one will be the lectures, us providing you with explanation about the articles. Of course, the reading you will have to do yourself of the mandatory literature. Then in form of the individual examination, you will apply these theories. We specifically selected an essay form so you can critically assess the findings of your content knowledge that you have collected and developed to write out your essay. So that's the build-up of the course. Now, for today, the introductory course. First, we will talk about complexity and perspectives within a healthcare context. Then we very shortly are going to talk about ontology and epistemology and how to study this. As I said before, you're all from different disciplines, so to revisit what the constituting credos are of your own discipline and how those disciplines can be bridged and how research questions are formed and how you study natural social phenomena will be helpful to better understand the literature and how to view healthcare from a social science perspective. So then we will go on to paradoxes in organizations. We will have a little break of 15 minutes, then discuss structure versus culture, the enigma of health, the literature, and the last session is reserved, as mentioned before, for the assignment. All right, so healthcare. Now, first of all, the question, and maybe think of this as I'm asking it, like what you envision. So what is healthcare? What does healthcare mean? What is the first thing you think of? Now, there are many ways to answer that question. First of all, I start with a very simple form, the structure of the Dutch healthcare system. It starts simple, 3 big parties, 4 in between, which refers to how it is organized in the Netherlands. But now, this is just a static graph of the Dutch healthcare system, but what is all below that and going on there? Healthcare can be a lot of different practices. So maybe you thought of the operation room in a hospital. Maybe you have thought of taking care of the house in elderly care. But then also there are different professions. So not only the practices and tasks in healthcare are diversing, but also what kind of professionals and identities can we find in it? So maybe your GP would be one. Maybe the informal caretaker, maybe multidisciplinary teams, the volunteer, the surgeon or the medical specialist, the psychologist, management, and it can be a hospital. So we also have different locations on top of all these different professions, or an elderly home. So just this is to give you an idea what's below the structure and see how many different actors are and practices are there in healthcare. So now we just talked about the professional roles and the actual practice of conducting healthcare. But then there are also other parties like the insurance company. The municipality especially has maintained a bigger role since the decentralization in the Netherlands of 2008. Patient Federation. This man we all know by now, ministers, for example, politics or public figures. Well, that's just to give you an idea how multicolored the practice of healthcare is. And if that wasn't enough, this year we got a pandemic on top of that. And in the end of March, it all exploded. Just look at a bit of the headlines over here. All sporting events cancelled, panic buying, elderly most at risk, etc. Brexit, of course, was still happening. We sometimes forget about that. And then a lot of ethical questions about how to organize care were raised, like how many beds do we have? Do we have enough beds at the ICU? What shall we do when full capacity is reached? Also, some people thought coronavirus might be a bioweapon or just a flu. So the mental health maybe of people might have been affected as well. We went to the 1.5 distance society. I think you might recognize this picture. This was the head of the police in the Netherlands at a wedding, not conducting to the rules. The nurses and the masks, and there were two, not enough in the beginning. And then when we had enough in healthcare, we were also obliged to wear them. I think most of you already got tested by now, but hopefully and luckily, there will be a vaccine very soon. All right, now a little flashback. This was just to give you an idea of how different and multicolored and complex healthcare can be. This is a flashback from last year, which I thought was interesting to include. This is how it started off last year, what the overall developments in healthcare were in January. If you look at them, I think they have not been on the agenda that much this year. Because a year later, we all know this was happening. This is just one graph, a simplified graph of all the events happening during the last year. So, all a little tired, as I asked you before. It has been a lot, but although we will include this, and I have been going into this, I'm now going to go back to the organization theory and have a little break from the corona complexity, and we'll get back to it. Right, just a small translation for the non-Dutch speakers. I couldn't help but pick this one. This is a little comic. The left guy asking, "Do you believe in the cloud?" And the other guy saying, "Well, I think there's something." So, different ways to study organization, just a small introduction, because there are different ways as this comic might give away to you. Now, I first have a little video. I'm going to put it on and then I'm going to mute myself. It's about 5 minutes and it's one perspective taken on how to research, study, and organize care. It is from a guy who is a medical specialist and an anthropologist making the plea to maybe look at hospitals in a more social angle. So 5 minutes and then I'll see you soon. It might take a minute, but it should work.
One thing that unites all of us here is we hope to create change, whether in the construction of new technologies or the creation of new cultures of participatory medicine. I study how culture change occurs in vivo on hospital units. And what motivates me is what I think is one of medicine's deepest, darkest secrets. If you look at a chart of the top 10 leading causes of death in the United States, you won't be surprised by a lot of things you see. Heart disease, cancer, pneumonia, stroke. On the right side, what I've done is I've added a column for preventable deaths from medical error. These range from 44,000 to 98,000 to 400,000 deaths a year. These are deaths that we're causing as a healthcare community. And these numbers are really, really hard to come by But even at the lowest end of that spectrum, that's about equivalent to a 747 crashing every single day in the United States. We've known about this since 1999, but the reality is research has shown that we haven't really made a big dent in these numbers. And my question as a student has been, given what we know, that it's a major public health issue, and that healthcare historically has been at the forefront of innovation, why is it so hard for us to change healthcare? I'm coming at this through the tools from anthropology. So as an anthropologist, I study cultures in the same way that an anthropologist might study culture in a far-off tribe in the jungle. However, instead of studying that tribe in the jungle, I study doctors, nurses, patients, people who work in the hospital, basically everyone in this room. And I use the same tools. I try to understand how people understand their culture from their perspective. Through the eyes of an anthropologist, the hospital looks like a really weird place. People wear bright colored uniforms that seem to delineate both class and caste. There's elaborate rituals of scrubbing and rounding, and people wear magical amulets around their neck, and they walk around and place them in healing gestures onto patients. It's a pretty weird place.
So Mario, sorry, you need to unmute because we cannot hear the video. I think.
Rather than any sort of conscious engineering. The third is that hospital tribes do not have the same values. A simple example of this would be the issue of timescales. Nurses tend to focus on the most acute issues facing a patient within an 8 to 12-hour shift, while physicians will tend to focus on patients over a longer course on diagnosis and treatment. Fourth, tribal members do not always understand each other. As a medical student, I was definitely guilty of this. I did not understand what nurses and nursing technicians and social workers did until I spent my entire day with them, learning how to do assessments and trying to see how they view the patient through their own eyes. Finally, our tribal priorities are actually contested. This is a study that was published in 2012 that actually found that it's a national study that actually found that the most satisfied patients actually had more hospitalizations and also were the most likely to die. We talk a lot about patient-centered care and patient satisfaction as being universal values, but the reality is that they're still contested. So why should you care? Let me tell you what's at stake with an example of what happens when you don't. This is the WHO Surgical Safety Checklist. We have fantastic evidence of its ability to decrease mortality in operative settings. And this has been sort of confirmed with research worldwide. What happens is when you send medical students to audit the surgeons, as they did in this study, you'll find that compliance rates of even just the check-in procedure ranges from 99% to 48%. Huge variation. On some of them, they drop as low as 9% of completion. So my message is this: we tend to view checklists, and I view checklists as the simplest form of technology, but we tend to view change in healthcare settings as technical. The reality is that all change in healthcare is actually social and cultural, requiring changes in relationships, beliefs, workflows, resources, and culture. And if we recognize that, we need to all become anthropologists. We have to understand the system. We have to understand the people who work and live within it. And if we can all be anthropologists, only then can we hope to ignite change. Thank you.
No. No. Sorry about that. I think my computer had a. Ooh. You must be kidding me. Okay. Oh, you're still here. I'm sorry, something went wrong with my computer. Are you all hearing me now? Again? Okay, good. I'm happy I didn't swear. Okay, just give me 1 second. Sorry about this little delay. I think I have a bug or something going on. All right. It seems like my Keynote does not want to open again. For some reason. So let me try to.
Maybe not to waste the time in the meantime, and until Marielle fixes out the technical issue.
Yeah.
Maybe I can talk to you about the topic of the essay that we have for this year. So the essay for this year is going to, as Marielle mentioned, is going to be this is going to be the only piece of assignment. So there's not going to be an exam, but it's going to be an essay, an individual written essay of maximum about 2,500 words that you have to submit at the end of the course. And in this essay, the topic will be on it's a very timely topic. We thought it probably makes perfect sense if we're talking about healthcare management to include something about the current pandemic because it affects everyone. It's the big issue. And now healthcare is after a long time, at the headlines everywhere in the world. So it's the top.
All right. Jannes, I think what I'm gonna try to do, because somehow my PowerPoint doesn't want to open anymore, is that I'm gonna go out quickly. You can keep talking, right? And I'm gonna restart so we can pick up then, yeah?
Okay, yes.
All right. Okay, see you soon.
Okay. So as I mentioned, and apologies for this, but it's things can happen that it's out of our control. So the topic is going to be the pandemic. So it's the current COVID pandemic, and then it will be the topic where you can apply some of the concepts, the theories, and the ideas that we will discuss in the lectures, but also you will read during your in the literature that you have allocated to you. So the topic can be anything around the pandemic. So it's up to you to decide on what exactly you're going to use, which exactly area that affects that is around the pandemic that is of interest to you, or you would like to explore it a bit further. You can apply that to your exam assignment, to this kind of essay assignment that you have to submit in the end. It can be, for example, if you have a focus in particular hospitals, maybe you can see on how IC units managed to cope with this unexpected event of the pandemic. How, for example, public health and primary care coordinated their activities. It might be about communication and how they communicated the RIVM in the Netherlands or any other similar institution that coordinated the response to the pandemic, communicated the risk of the pandemic and the response and the measures that had to be implemented. How particular measures that have been introduced, especially in the healthcare realm, have been implemented or resisted in the real world. And then you can get a bit more information from the press, from different media sources about what is happening, different reports. There's an abundance of information of all sorts in think tanks, in particular institutions that they do research there, very good essays and different articles, opinion articles in good newspapers or magazines. So there will be an abundance of information that you can it can stimulate your thinking, and you can use as factual information and background to your topic. And then in order to analyze it in more depth, the idea is that you will use some of the frameworks, some of the concepts, some of the theories that we will discuss in the course. So you're not going to just describe the different issue, so you can present the background, how important this area is, why did you decide to focus on that particular area, what motivates you to look into that topic, and then you will, by applying the different tools and the different concepts that we will introduce, you will deepen your analysis and you will get into a much better and broader understanding of the different factors that contributed to a challenge or a dilemma in that particular area, and what can be done, or how have you improved your understanding by applying these concepts to the overall topic. And that's more or less briefly the idea of the essay and the topic that you'll be working. And of course, we'll have the opportunity to go in more depth as we go along in the different areas. As you can see, Marielle is back.
Yes, I'm back. Sorry for that inconvenience. I guess playing the video was too much for my computer, so that's good to know for next time. I know that when I'm muted, you couldn't hear the sound anymore, so I will put the link on Canvas if you want to revisit the video and watch it again. Now, okay, thanks Jannis for already explaining the assignment. That's good.
And just a more small thing is a question from Dana. Do you need to put your own opinion in the essay, or does it need to be purely informational? No, you have to put your own opinion in the essay, and that's the idea. So you don't just present information from different sources, but it's also you distill that information, you reflect on the information, and you integrate the tools that we are going to introduce in the lectures to have a more in-depth reflection of the topic. So what have you understood now differently by using this particular concepts, this particular lens that we introduced in this course? How have you broadened your own understanding of this particular topic of the pandemic? Or what can be done in general, and what can be an action plan in that particular lane? So you don't have to always end up with an action plan, but you can also reflect on your own learning and how you have understood the different concepts that we introduced by applying them to this particular topic.
Yeah. So I've added this year the article of Wingate that specifically goes into how an argumentative essay is built up and what components it needs. So I will talk about that in the first session, but it nicely breaks down and enlightens like what an argument actually entails. Now, I think one of the interesting things that that article specifically makes is that students tend to, with an essay, make it a thesis antithesis argument, so a dualism. You can also have multiple views and integrate them and then come to your conclusion. But again, as Jannis said, yes, it is not a report. So it's not a report of the content knowledge. It is an essay, so that involves that the author will position him or herself. Anyways, but that's good for now because I'm gonna do this quickly now, and hopefully I might go a couple of minutes over the 45 minutes, but I'll try to do this quick as I can. I'm going to do this very shortly because you can give a whole course about ontology and epistemology, but I wanted to give you a little background knowledge to understand that this study comes from a different angle. And for that, we need to revisit back to the roots, of science, basically, like what your discipline usually sees at what is existence, what is being. So first of all, ontology, that's the study of how you see reality. So do you see it as an aesthetic thing that can be measured and understood by observing it? Or do you see it as something that is more constructed? I'll go on to that on the next slide. As opposed to epistemology, they're not really separable, but that looks at how you can contain knowledge and how you should study it. So that's more looking at methodology, like how do you want to approach a phenomenon. Now, from the social sciences, that would be looking at it socially constructed. And then usually, I must say, and then how do you measure, how do you research that phenomena, how do you grasp it and enlighten a topic of interest? So to clarify that a bit, because this might seem a bit abstract now, I made two pillars out of this, but there are a hell lot of different approaches that, or ontological and epistemological, sorry, I slipped there with my tongue, that we could discuss, but for now, I think this split up might be the most convenient for you. So on the left side, I put objectivism, which is usually more connected to natural sciences and quantitative research. So as I said before, it looks at reality as something that is there, that we can see and study, something that we don't interact with. So tangible and static, reality exists out there and it's independent of interpretation of individuals. Also, as it gives away, therefore objectively studied. Now, opposed to that, usually two ends of the spectrum is subjectivism, which says like, no, reality is a co-construction of us humans who live in there, and looks at interpretation, meaning making. It's fluent and it evolves. So we are not objective entities, not as researchers, not as human beings, but also have our interpretation and co-create things. This would look more at like social interaction and how we mold and shape it and the relations between people. So it's very static. I can answer questions about this later because, as I said, this is a big topic. But now, so then I made another distinction here, but I'm going to skip this one. This is another pillar, but that goes more into how we actually, when we have an approach, when we are from a discipline and look at reality, how we actually measure and come to contain knowledge about a specific topic. So as I said before, positivism would be more usually from an objectivism stance, and measure and test looks at this as a static, usually deductive, so starts with a hypothesis, yes or no question, and usually a quantitative tradition. Opposed to that, and which we will discuss more in this course, is interpretivism. So looks at it inductively, so asks how and why questions. It's more qualitatively geared, and looks at social phenomena. Now, oh, there's one slide that I'm missing here. What I want to state here with, because now I put them opposed from each other, is that these, although they're often presented as exclusive and maybe even dogmas, but I think, and what is also the aim of this course, is that they can be complementary to each other. So different disciplines could actually add to each other. So one doesn't exclude the other. That means, so think of mixed methods, for example. If you have a phenomenon that you want to study, like how can you approach it in different manners to actually enhance your understanding? So as for now, how they're often posed, I said versus, but it should actually be and. Now this is quite tricky, and for this course, we will look more at the softer side, the social side of healthcare organizations and social processes. But I would all encourage you to take all these approaches with you and not see them as exclusive but complementary. Now, as for here from social sciences now, as I stated, that comes from a more subjective stance. And we like to kind of look at maybe a bit of the friction and the tensions that happens when people co-construct and start interacting. Now, a couple of illustrations that what social sciences would look at, especially when it comes to organizations and where there's sometimes friction and it's not as clearly cut, I will name in the following. So, for example, formal versus informal. We're going to talk about structure and culture later. If you look at how this year has been, how things were formally arranged, but maybe how they went informally, just to pose a little question. I assume that most of you have worked or are working, have a part-time job, maybe full-time job, how things are presented on paper on a website and how they actually occur when people interact together with different identities, professions, different incentives is usually quite different from what was presented on the front at the front door. So this is one of the frictions that organization science would get into. What you see then, to state it in another form, is that you have an ordered form, the structure, and you also kind of have a disordered form of organizing. If you look at this year, how the order was of healthcare, go back to my first sheet of one of my first sheets of the development of care and how that changed from the last year. You don't have things in hand, especially when it comes to social phenomena and how we react on that. So things are not always ordered, but sometimes also a bit messy. So where lies the point of friction and what happens there, especially when external forces come into play? So here's another one. I wanted to show this one because I really, it's the same point I'm making, but quickly, I always think the left looks like way more fun. I mean, imagine if you're a kid, would you want to have the sandbox all nicely ordered or maybe a bit messy? So messy is not a negative word per se. It's also something to stir up the pot and make change. So then we have front stage and backstage. They blend into the former slides, how people present themselves, how organizations present themselves. What meets the eye at first or at first glance is not always the same as what happens backstage. I mean, I've been thinking very often with all the government regulations now, like what is happening there backstage and what do they show us? Like, for instance, like the lockdown and when it's presented to us, how long is that already planned out? How long do they know this? Is there already a plan maybe in hospitals what they will do when healthcare gets saturated? So what meets the public eye and what happens backstage is a different thing. Expectations versus reality. Often we tend to think of organization processes as linearly occurring or present them as such. So we had a process which went from A to B, but it's usually not a straight line. So there are curves and turns along the road that diverge and change our path, which happens when people socially interact. And you have different players at the field that might do unexpected things. Okay, so to close this off now, I quickly took you through the different perspectives, and now I want to provide an illustration to make it a bit more tangible, also for you when you have to write your essay, to see how these different approaches have to do with how you view phenomenon and how you want to measure and approach it, which is often the question. Now, Mr. Smith, I'm going to diverge a bit from healthcare, but this is about pain, which does interconnect with health, I would say. He's an Australian biologist who did research on pain. So, what is pain? Now, what he first asked himself is how to measure pain. So he looked at values of the poison, how long the burn stayed, how big the mark was from the sting, etc., etc. So he conducted quantitative research on that matter. After that, he did not feel satisfied. He was not content with the knowledge he had gained, because what was it with pain now? So he asked himself the question, how is pain experienced? So what he did, and I always really like this story, he had a lot of insects all listed, and he let every insect sting himself and described how the pain was feeling. So just a couple of examples here, because I think it's beautifully written and very vividly described. The bullet end, pure intense, brilliant pain, like walking over flaming charcoal with a 3-inch nail embedded in your heel. And another one from the warrior wasp. I think this provides a good example because in the end, he combined his two studies to address what pain actually meant. So as I said before, perspectives are not exclusive. They can be complementary. For this course, we will look at healthcare from a social perspective, but for the future, if you can combine them to get a more extensive understanding of a phenomenon, I would always applaud that. And then you get a lovely graph like this. So how long do we have? Okay. I think I'm gonna let's start the break now, I would say. I mean, we had a bit of a delay because of my technical problems, but I think a 15-minute coffee break would be good. And I have a couple of sheets on culture versus structure, but I can include that in the next session. Would that work for everybody? All good? I see a yes. All right. Well, let's have a break now, have a coffee, and be back at 11:15 then. Yeah? Janus, are you still there? right, I'll start again in 1 minute. I hope you all got your coffee by now. Yes. All right, I see a face again. That's nice. And more. Thanks for all putting on the camera. All right, it's 15 past 11, so lots to do, so let's continue. Good to, I think most of you are back now. Well, I will answer the question that was on the chat now, that was sent by Dana. It was mentioned a few times that the views are not exclusive, but that in this assignment you don't have to integrate them together. I do not really understand what's meant with this. Do you mean that you either choose subjectivism or interpretivism? Because we have to talk about social issues. How do you choose between ontology and epistemology? You don't have to pick for the assignment between these different disciplines. Why I included it is because all of us are from different disciplines, so it's just to get a grasp that the disciplines come with different traditions. Why I'm always very specific about mentioning that they're not exclusive is because these disciplines can, and you sometimes see that in science, if I may say, become dogmatic. So they sometimes tend to think that there's only one way of studying a phenomenon. Which I think, as the Schmidt scale shows, there are multiple angles to come from. So it's just a revisitation for you to kind of see that and see maybe where your own discipline is usually embedded in. You do not have to put this within your essay or discuss these. I mean, you may, but it's really a side note of the course to go back to the fundamentals of these traditions to understand that social science takes on a different angle, which is usually on the subjectivism side because it studies the complexity of social phenomenon. Is that, I think, will all the concepts and theories discussed in the articles also be discussed in the lectures? I have included, for the mandatory literature, we will always discuss them as well. So I will do this in the second part of this lecture now, and we'll do that in the following lectures. Just now for the ontology epistemology question, one thing I want to add, actually, these two are inseparable. So what it shows is that the way you look at a natural or social phenomenon is inseparable with how you then methodologically study it. So that's why usually subjectivism, if you believe that or you approach a phenomenon as being socially constructed, it would not make much sense to go and measure how that is experienced by people. So as social sciences looks more at experiences, how and why questions, you usually get more qualitative questions that are associated with that. Is that clear for now? All right. Very clear. I'm happy to hear that. Thank you. And also, if you have, if you want to have more information on that or have questions, I never mind it if you ask them to me now, but also like later in the sessions, I will put down my email. Never hesitate to email me if you need any clarification on these topics. Yeah. All right, so now let's, that we're all there, continue with continue with the lecture one. I will share the screen again. No, wait 1 sec. Yes. Mm-hmm. 1 second, I'm just want to see. You all. Yeah, all right, there you are. And let's continue. So as where we left off, culture versus structure. This is one of the two main pillars that often cultural organizational studies look at, and kind of at the friction point or the edge of this point, like how they interconnect. As I said before, we can look at frictions between informal, formal, backstage, front stage, and they often have to do a lot with these two components. So a structure is what, to simply put, what we see on paper from organizations. And that stands opposed to culture. So you have social people with social relations, with identities who are interacting within the organization. And that's where sometimes it can diverge from the structure, which is not diverging as an employee. Let's say it's not necessarily a bad thing, but also causes innovation, change, and things like that. So we can adapt to our environment, and organizations can adapt to external forces. So just a quick definition. Of organizational structure. The formal configuration between individuals and groups regarding the allocation of tasks, responsibilities, and authorities within the organization. As I mentioned, so this is the formal part of an organization, the one that is written on paper. What you usually see then, and also when you go to websites, you see these structures thought out, like how the system should work. Often though, that is just what you see at the front door, and what you can find online, and what organizations present to you. Now, this iceberg model is one that is quite popular at our department to illustrate how these two are interconnected, but often there's only one part that organizations want you to see. So above the water, we see vision, strategy, shared values, goals, policy, structures, procedures. This is all policy making usually, and what an organization is tend to do. What is underneath that are beliefs, identities, values, norms, stories, etc. And also, let's not forget feelings. People are not robots. Otherwise, everything would be automated. So these are also definitely a part of social processes within organizations. So these we had. So another model of these two and how they are in interplay, and just like the iceberg, it shows that it's these two interact together. They're not inseparable, and they're also both have their value of adding to the organization of people. What you look at, however, and what you want to study, that might be a difference. So are you going to also, for your essay, are you going to focus on how a structure is arranged, or are you going to see how culture plays a role and how these two are interconnected? Yeah. So 2 questions, and think of these, what you would answer. Like the one would be, can organizational culture will be managed? Actually, if you wouldn't mind, I want to try this and see if we can maybe discuss this together. I'm going to stop sharing now. So maybe one of you wants to be brave and be the first one to speak up. Like, who thinks organizational culture can be managed? You can also put it in the chat, yes or no. I don't see anything yet. So who thinks culture can be managed? Right, I'm gonna try this differently now to see if this works, and just ask one of you. So I'm just gonna pick a random person now. Fabian, if you will unmute.
So I would think culture can be managed to a certain degree. Organizational culture, like by, I mean, the managers already set some kind of example with choosing which kind of employees they want to have, which kind of behavior they reward or punish in the organization. So I think it can be managed to a certain degree, but it's not as easily managed. And also cultural change within an organization takes a long time to be accomplished. And also it's also difficult, I think, to actually achieve the change you want to. You can aim to change the cultural the culture of the organization, but you can also end up somewhere totally different than you actually intended to. I think it's very difficult to do so. It takes a lot of time, but I think it can be done under certain circumstances.
All right, very critical perspective of that already. So let me ask somebody else, maybe Sanna.
I also think that it can be difficult to influence, or that it can be difficult to influence the culture, because it's something that is built up during the years, and that makes it difficult to change it in the end, because people, they stick to what they know, and they start to value that, and that becomes the culture in the end. So that would be my view.
Yeah. Is there anyone who has a different perspective on this, who says like, yes, you can definitely manage it? Well, that's good. Now I have another question that's also on the slide, and I will show you later, but just because we are interacting now, I'm just going to pose it like this. Like, so, even if it's tricky to be to manage culture, whose responsibility is it? Is it the job of the management? Now I'm gonna let's see. If I can see somebody. Can I ask Anne? Well, Anna maybe doesn't want to talk. Okay, Suzanne van Veen.
What was the question again?
Hi. Whose job is it to manage organizational culture?
Yeah, I'm sorry, I don't know.
That's okay. All right, we can, anyways, think about these questions as we proceed, but well done everybody for speaking up, and let's hope that we can have continue interacting. I'm going to share the screen again now. So, job of management. So here are two definitions that I will give of organizational culture now. The difference in this is that if you look at the first one, it is quite top down, and the second one is more fluid as a process and a complex system of how you can look at knowledge of members and social interactions and how they all influence each other. Now, there are hundreds and hundreds of definitions of culture, but this is just to show you that even within that, you have different views on how and what culture is and how it should be managed. The most traditional view, however, what you often see, you see it in big corporations, but also in healthcare organizations and in organizational literature, is that it's often thought of as a static thing that is very top down. Like, okay, we are the management and we organize this culture, we have made a structure and we're going to impose it down. Usually, in reality, it does not really unfold like that. And that is where social sciences step in, like how does this actually unfold now? So a critique has been for the last, well, maybe even 2 decades, that it's often viewed as a static thing, like culture can be managed. Besides that, it's also often seen as something that happens linearly. So we'll have a cultural plan, we're going to impose it on the employees to create growth and success. So very much a quick fix, something that stands along the sideline that can be implemented, while instead it's not an external factor, but rather it's something that's ingrained within the whole organization, that is historical, that is social. For example, if you have a family business that exists for decades with people who work there for a long time, they have their modes of how they conduct, how they work, and how they relate to each other, how they are socially with each other. That's also, well, one of, and I also always doubt this a bit, there's one quote that you often see phrased in articles about organizational change, is that the average cultural change takes about 7 years. So just to indicate that it's not something external you just implement. Also, if you refer this to the corona crisis that we're in now, if you look at different countries and how they arranged healthcare and decisions that they made, like for example, the Netherlands was one of the last to where politics said, okay, we're going to have mandatory face masks. There is a difference in that, and there was a lot of resistance concerning that. One sec, I have a chat. All right. Okay, so instead, culture is rather emotional, not strictly rational. As we saw the iceberg, these two are in interplay. There is a structure that is inherently connected to culture and they interact with each other. It's related to history and tradition. difficult to grasp because often when you start a new job, you always have to figure out like what the fine grain is, like how people interact. Like, do you approach each other informally? Is it okay to make jokes? Stuff like that. And you learn that along the way. There's no protocol or no writing that will tell you, hey, this is how we all interact. So it's collectively shared by a group of members, but also in addition, subgroups. If you go into a hospital, whether you're with a group of nurses or medical specialists, is very different what the informal protocols are and how you approach each other. But even within those groups, I know from my research, whether I would talk to a pediatrician or a surgeon would be very different. Whether you talk to a nurse from the IC or a nurse from elderly care, let's say, there's a very different culture attached to that. Also, when you look at these groups, and which makes it even more complex as they interact with each other, you usually also get kind of hierarchical structures. Like, for instance, at a hospital, the IC nurses are kind of, well, they're at the they're the head of the pack. Like, so in interviews that I did, it is often thought of as a common goal to get to the IC. And that's where you reached the goal of being at the top of the pyramid. Whereas when you choose for elderly care, it's very different. All right. Okay, so the literature of this lecture. Grit and Dolsma, we have Plesek, McDonald, and Wingate. Wingate is about the essays we will talk about in the third session. I selected these to kind of show how you can study social phenomena in different manners, and that apply to a healthcare context. Now, one very quickly visit to literature that I did put in there that wasn't mandatory, but I think is interesting, especially in times of these, for you to see how rationality can sometimes clash with nature. As we're studying healthcare, we're kind of getting to the core of that. It's not a static thing. It's not just a rational thing. It's actually, when you get to the nub of it, it can be about life and death, which makes it a very human profession and also a very professional field to look at and to study. These things are kind of inherently embedded in a healthcare context, which, as Gadamer would say, always creates an enigma between some of the dualisms that we have talked about, the formal, the informal, the rational versus the non-rational, the emotional maybe. So very quickly, I have, there's an overview, there's a review that I put in the recommendational literature now for Mailman. I have the book myself. If some of you is very interested, then send me an email with just all I ask, a couple of lines why you're interested, because then I will scan it. But for now, if you're interested, the review would give you an interesting perspective. So Gadamer was a German philosopher, wrote a lot about these point of intersections between rational health and the course of nature. Well, one thing is, and I only saw this, although I've read a lot from him when I put this on the sheet, look at his date of birth and when he passed away. Oh, sorry, there's a 9 in there. That should be a 0. He was born 1900s, and he did not turn 12, but he turned 102. So he must know something about that. So the distinction that he makes, or he critiques maybe, is that in the last decades, we have gone towards an objectification of health. We all know that there's more technology, we get to know more, science is developing, which has given us a lot of benefits from modern health and how to heal people, how to fight diseases, medicine, etc. What he goes into, though, and that's an interesting intersection, is that we kind of maybe went overboard a bit with thinking that we're the master of health. And he opposes the following to that, like the restrictions and the limits also of this rationalization. I think why this piece is interesting is because we have seen it this year, is that sometimes nature just runs its course and it's not about us controlling it, which is a carrot on a stick or the pot of gold at the end of the rainbow. So we are not the master, we cannot control it, we cannot extend life until forever. There are external forces that we will always be subdued to. So besides the critique, the point that he makes is that the managing and understanding healthcare should be about the balance of assisting and understanding nature. Now, for the students who have who are studying medicine, the couple of 5 pages especially go into this. He talks about the peculiarity between practicing medicine, the know-how, the practical know-how, the feeling that you have, the instinct, the knowledge that you maintained from working with people, which never follows a strict schemata. So, and the balance between those. So, very quickly, the point that he makes, it does not make or produce. It is to know its course and be able to assist it. So that's one. The task of medical practice, hence, is not to force control of nature, but assist the recovery of the patient. Now, I'm gonna name one example, which I think is very interesting and sparked my interest for sure. And that's the following. And I picked up this quote of the article to kind of illustrate this breaking point. So I have a colleague who is doing field work and research at the ICU. And I won't say which ICU, but what happened there now is that they are trying out an algorithm. And this algorithm will give you an indication of how long the patient is going to live for, how big his chances are. This is just an illustration algorithm, by the way. This is not the actual one because I couldn't get my fingers on that. But it gives an indication of what the chance of survival is and how long the patient is going to live. Now here, one of the ethical dilemmas that I think we should think about, we are living in an age of algorithms, and especially with healthcare, I think an ethical component plays a part. So it won't be, you have the doctor standing at one point with his know-how, practical know-how, his practice of medicine, which he's done for years, and has been trained to do, opposed to technology, who will tell him whether to let a patient go or not. I think this is one of the dilemmas that is something to explore and not take lightly. And these are decisions and friction points between rationality, technology, and the social part of healthcare that you often see occur. All right, is this all? I hope this is all clear. All right, so that was Gadamer for Who Wants It So. I can send you the book and I'll encourage you to read the recommendational reading that I put online that will go more into that. All right, then Grit and Dolfsma, the dynamics of a Dutch healthcare system that is. I selected this article because it shows how we think of healthcare changes over time. Now, for the students who are not familiar with discourse, discourse is the study, well, discourse analysis is the study of language to see what values, norms, morals are in the zeitgeist of nowadays. So, for example, where the discourse half a year ago was that we were all against wearing a face mask. Now that kind of passed away, and we're talking about who will be vaccinated first. So you can read up on all these specific discourses and all their details, but this is to show how, with how we approach healthcare is not a static thing. How we think of healthcare now is different than we did 50 years ago. So very quickly, their analysis goes into from 18th, 19th century, what developments there were, which are inherently interconnected with how we organize care. So in the 18th and 19th century, when healthcare was based on more religious values. So what you would often see is that healthcare would be at monasteries or monasteries, and it was arranged in that sense. This changed in the 19th and 20th century when it was more shifted from religious purposes to medical incentives. So in that sense, professionalism arose were developed, where the emphasis of who was responsible for care, how to arrange care, was designed around this. In the 60s and 70s, and that was mainly because to put pressure on costs to keep healthcare affordable, it moved to a bigger political spectrum. So responsibility came in hand of more of the state and how to organize it, more top down, more centralized. Now, the last discourse they talk about, and that's from the 90s on, it shifted backwards as we, as a society, and then you see that the norms and values of our society are entangled with that, as we started with how it was first interlinked and based on more religious values. As that shifted and we're living in a more liberalistic, maybe neoliberalistic society, also the way we organize health changed. And new public management, for example, came into play. Now here you can think of privatization of insurance companies, for example, decentralization to municipalities, organizing care over boundaries with multidisciplinary teams. These discourses are also not exclusive, they can exist together. As I said before, where formerly healthcare was arranged on more religious values, it is not so that that doesn't exist anymore and there's nothing based on that. So although one discourse can be front stage more in the public arena, there are other discourses that are in that and that interact with each other. And they can also clash. I mean, think of the privatization of healthcare and our different political parties, which some vow to go back to the different public system. This is not, and that's maybe important to know, clashing discourses is good for it to keep evolving. If you have no argument keeping each other sharp, then we will have something of regression and standing still. So that there's debate and that there's argument is actually a necessary element. And then now to show how it changes and maybe to include also in your essay assignment, Grit and Dolsma only went to the 90s, 2000 maybe, but it changes all the time. Now, with what is happening the last year, it will be very interesting what will change. For example, in the third lecture, I will talk about innovation. what was a thing for a long time, the last couple of years, the Netherlands has scaled down on ICU beds because everything had to be more lean and more cost efficient. Well, with external factors and in times of crisis, that perception really got challenged, as you see now, when it came down to life and death, and maybe being in the situation of having to choose who to take in there and who not. So it will evolve over time, and especially with this year, there might be a major change in how we see arranged healthcare. Now, this is a short, this I will go shortly, and it's also a short article. This talks about that on micro level, as Rit and Dolfsma have discussed the discourses in a more macro level. So how as society, how publicly, how politically we view healthcare. Is attached to how it is practiced on micro level and can also be studied in that sense. So this goes in this article, McDonald and others consult how their study looks at how this occurs within a hospital and how medical specialists and nurses can sometimes be opposed from each other. The main pointers of their article, so how discourses, views, narratives can clash. They position it from nurses to medical specialists. This hospital was looking to implement a safety culture to be more safe. And in their case, it was supposed to be accomplished by having more rules and guidelines. When it was implemented, which also links to how cultural changes might be different and might have effects that we did not expect formerly, is because these two subgroups within the hospital or two different cultures view them very differently, it actually caused the opposite effect. So as nurses said, okay, we're going to do follow these guidelines, doctors opposed with that and said, no, I have my practical knowledge and I will see it per patient, and did diverge from the guidelines, which ultimately caused different groups to clash. And even though it was the goal to reach safety by formalization, because of these clashes, it actually, the protocols diverged more. Then quickly, the challenge of and complexity of healthcare. The last article talks about the complexity of organizing health. And what they do, Plessig and Greenhalgh address that with stating that it's a complex adaptive system. So they approach healthcare as a collection of individual agents that have the freedom to act in ways which are not always predictable. This is especially, and I think that's why they say healthcare can be better understood by seeing it as a system like this, because you have, first of all, a lot of different subcultures and discipline with very deeply ingrained knowledge, like an anesthesiologist has very different knowledge than a surgeon, than a nurse, than a manager, and they act on how they were trained for years to apply that knowledge. So also the depth of knowledge and the difference in that knowledge from different professions puts a lot of autonomy, or gives a lot of autonomy, and luckily, with people practicing health. What comes with that is that they also have a lot of freedom, which is good, because who would not want the doctor that might see something different with you as a person to go by how he was taught and his knowledge to treat you? As a consequence, though, is that these are not structured protocols. These are not structured protocols of organizing. So, and that's what this is referring to, it is not totally predictable. Patients are not, and the way to assist and treat their health is not so either. So they talk about the edge of chaos. So that is, and you can find the model in the article as well. This is a way of seeing the complexity of organizations, like how much agreement is there on structures and protocols, and how much certainty is there from the external environment. As you see, with healthcare, both of them is low, so it would always be a high pressure environment for an organization, internally and externally, which makes it, or actually vows from it, to be adaptive as an organization. This goes into the different perspectives of healthcare and different how different specialists and actors can see that. So what they do is they unbear a couple of paradoxes or myths that we usually view care with. And that's, first of all, that it's often seen as to happen in a linear fashion. Due to its high complexity, that rarely happens so. To add to that is that we also deal with co-evolving systems. It's not just one thing that changes or is evolving at the same time. People, first of all, evolve. Our health and how we view health is evolving. Protocols are evolving. How it's politically arranged, government regulations, but also nature is evolving. Again, this year is a good example. So these things co-evolve, and they do not co-evolve in a linear fashion. So these are the quick pointers that are concluding to the article. So different perspectives you have, because you have different professions and actors operating within health. It is not a linear process. Tensions arise from that, and it's the core, as Gadamer talked about, of health, how we see health, rationalize it, seek for the help of science and improve our healthcare, opposed to that humans are not clear-cut and static. And all these groups interact with each other. Right. Okay. Bit overdue, but not too bad. The third part we're getting into now after the break. So let's all take 15 minutes and then we'll discuss the assignments. All good? All right. Then I'll see you soon. Da, da, da. right when we'll have a couple of minutes, but when you're ready, we can continue to the last part of today's lecture. Yeah. All right, just for who's already there, if you have any questions concerning the two first sessions, then maybe put them in the chat so I can address them to make sure if everything is clear. Let's take like let's see how long we will need for that, but we can have a little bit of time to see if everything was clear to you all before we go into the assignment. Right. Okay, let's start off again then. Again, for who it is possible for, it would be, I saw the question, I will answer it. For who can, if you can put on your camera, that would be really great. It's not mandatory, but it does improve the interaction. So if it's possible, then that would be good, and thanks in advance. I already see some familiar faces already, so good to see you again. And let's start off the last session. Now, I first have a question from Eline. A more practical question, but will the sheets you have presented be uploaded to Canvas separately, or can we only review them by watching the recording? No, definitely before tomorrow at 12. Also, well, the recording will be uploaded. I will also put a PDF of the sheets on Canvas, and I will put on a link to the video that the sound was cut off from for a couple of 10 seconds, I think. So you can watch that back. Are there any other questions concerning the first two sessions about the literature or contents? Also, and just a little reminder, like you can always speak up and just post a question to me verbally instead of typing it down. All right, all good. Then let's get started on the assignment. Right. Okay, for this course, so as we talked about before, we changed up the evaluation a bit. So instead of getting out there and interviewing healthcare actors, you will be writing an individual essay. This will count for 100% of your grade. It is individually written. It's one of the topics of the course or more if you want to bridge them, that's also fine, and address one of the dilemmas, challenges concerning the response of healthcare organizations to the COVID-19 pandemic. You can hand it in on Canvas on the 29th of January before midnight. Guidelines and the grading rubric are on Canvas. There are 2 documents that you can find. So one of them is a detailed description of what the content should be about of your essay, also states a couple of examples of topics that you could discuss, and some guidelines that we will look at. And you can also find in another file a rubric that we have split it, how we're going to assess you. We split it up in 5 sections, so you have some insight on how it's going to be graded. Now, what I would like to know, so for who is it clear how what an argument is? If you could all just maybe put it in the chat or speak up, that would also be good. But what, just name a component. What is an argument? An analysis, yeah. Any more ideas? Anybody else? What do you think of? A fact? A reason behind a statement, providing one's constructive position or opinion, facts in favor or against a given statement. An assessment of a vision, article, constructive reasoning as why your statement would be correct. Position based on a critical review of the literature. All right. Well, these are all pretty good answers, I would say. And also, as I said before, I attached article of Wingate in the mandatory literature. One of the things that is discussed in the article is a questionnaire when students were asked, like, okay, what composes an essay? So you can see that and review that. Now, a lot of these were also mentioned, but let me first start quickly with the first 2 that were mentioned. So an analysis and a fact. I think both components are definitely in an essay, but I like to emphasize both of them are. As I said before, an essay, and that is critical, I think, to realize, is not just a report of facts. The author positions himself in a place. So, and then we go to the second one that is mentioned after that. It is providing one's constructive opinion. So in addition, although you back up your position with facts, there is a personal and subjective, you may say, component in an essay, which is actually exciting because it gives you the space for this assignment to be creative, reflect upon yourself, and apply that. One more I want to pick out, facts in favor or against a given statement. I will go into that later because that is true. That's one of the most traditional forms of doing an essay, is going by an anti-thesis. So I'm pro or for. You can also make it more complex than that. Like usually, especially given the context that we are studying now, it's not black and white always, or not clear cut. So one way to go is to state I'm for or against, like you would do in a debate forum. But another way is to also show multiple views and perspectives. This is also one of the things that is stated and explained in the article. All right, so what I'm going to do, I'm quickly going to go into the article and the main pointers that the article highlights. And then I'm going to try to work with breakout rooms, put you in groups to think of a topic and discuss them amongst each other, and I will jump in. All right, so first of all, an essay always, and that makes the essay unique as a writing form, involves or includes an argument that you are making. So there's an opinion on it, there's a position in it. So it involves the analysis for that argument. You need three components. First of all, there's content knowledge, because if you want to form an opinion, you first need to know something of the of the subject and select what is relevant to it, to your position, and what is not. With that, you develop a position or a stance that you will also highlight in your argumentation. Third, it needs to be positioned and written in a coherent manner. So it's not a composition of random facts, but there needs to be a line of argumentation. Okay, oh, wait, sorry. So another is, okay, the concept of an argument. So what makes an argument and what is not? Again, you analyze and evaluate the content knowledge, as was pointed in the former sheets. A position is developed and there's a presentation, which also interlinks with how you present it in a coherent manner. Is that the position and the presentation of such is an arrangement of logical arrangements and positions that build that up. This is more like I want to see if we can all interact a bit now and apply it to see what subjects we can use for the essay. So this, oh, sorry, I saw somebody walking by in one of the screens, which was nice. Where was I? Sorry, distracted. So these are elaborated on in the article more, and also examples of, especially like one is interesting. If you look in the appendix of the article, it gives you an example of how you can arrange that and do that with provided feedback of a lecturer there. All right, now quickly, some pitfalls. That's good to be aware of before you start writing and selecting your voice. This is based on the survey that's done amongst students as described in the article, like what often happens when maybe especially undergraduate students have not so much experience with writing an essay. So the first one is the solipsistic voice. So that's when you just only give your personal experience. So to call it in a different way, if you just give anecdotal information and examples to underwrite your position that you take in your articles. So as was said by one of you, that facts is a critical component of an essay. That is true. So you state your position, but you do need to back it up with academic resources. So the unveiled voice is that it's a patchwork of views and you're not making your own claims. That's the opposite of the first pitfall. So you do not, as an author, make a stance or a position, but it is a report or a review or an overview of just literature collected on the subject. So that's going to the other end of the spectrum. And then we have the unattributed voice. And that's making propositions as if they are your own. Now, referencing is a vital essence here. So make sure to distinguish between what is yours and what is others. So what's your stance and how do you back it up with research already done? So it's basically what's always good to keep in mind, or what I try to use when I'm writing, is to think of like, this is where the literature on this subject has gotten us so far, which is great, which is always a present to maintain new knowledge. And when you got to that point when you're saturated, like this is the knowledge I need, and have elaborated upon it, you have your own stance. But make sure that it's clear when you are speaking, when you are stating your opinion, on the contrast to when you're actually referencing to academic literature. Oh. Last note that I already mentioned, the most classic form is black and white, for or against. That is just one form of writing an essay. And also has a lot to do with how you structure your essay in the end. So if you're choosing a more complex structure that incorporates multiple views, you will also not have the most classic build-up for your essay. All right. Okay, I'm gonna, first of all, are there any questions now concerning?
I have a question.
Yes.
Because when Jonas first made an introduction to what we have to do for the essay, it seemed like we were supposed to write an essay mainly about an issue going on with the pandemic, and then that you had to integrate theories and concepts from the lecture. But now when you explain it, it seemed like an issue with the pandemic has to be like an addition, so not the main focus. So
Well, that for me, how to explain this well, would not, it depends on what you center stage in your essay. So will you address the pandemic as context that stirred up a certain issue, or will you center stage the pandemic that caused a couple of other issues? So that is a matter of how you structure your position. It is, however, so that both components are a mandatory facet and the main components of your essay. So yes, it needs to concern one of the discussed topics in the lecture or the literature, and it needs to be applied on the pandemic. But whether, let's say, your starting point will be the cultural differences between, well, maybe even the north and the south of the Netherlands or different countries, and how healthcare is arranged and how that now is unbared by the pandemic, or whether you start with critical issues on the pandemic, both can go for your essay.
that's clear. Thank you.
Okay, good. So it is like, so it depends on how you position it, but let me highlight though that both should be included. Like it's kind of, and that's the thing, like so my research is about innovation. I cannot, it like absolutely makes no sense if I talk to, let's say, have interviews with board of directors to pretend like Corona is doing nothing to how that is organized. So it is, if we review the last year, it is inseparable and has brought something really to the front. So also in a logical way, like if you would address, so let's say innovation in healthcare now, and would exclude the current situation, I would say you might have an incomplete argument.
Okay. So
Yeah.
the whole essay is actually going to be about integrating the theories discussed in the lectures with the pandemic. So
Yeah.
the whole thing has to be about that.
Yes,
Okay.
exactly.
Yes, that's clear. Thank you.
All right, that's great. Anybody else? All right, now I'm gonna see. Okay, this is quite strange because my the my button for breakout rooms disappeared. I don't know how often you have worked with Zoom already, but sometimes there are weird bugs in it. Aha, here we go. Okay, so I'm gonna divide you up. We're with 50 at the moment, so I'm gonna divide you up in 8 breakout rooms. Now, what I would like you to do is in your small group is already discuss a subject that you might want to address. If you go on Canvas, there are already, if you look at the guidelines for the assignment, the document, some suggestions that you could dive into or could address. But I would encourage you to maybe, although this sounds a bit contradictory with the situation, but get creative or whatever is something that has sparked your interest or has frustrated you, an ethical dilemma the last year, and dive into that. But for inspiration, first discuss this together. I'm gonna join you in the breakout rooms and see where you're at. Well, later we'll have a little close off, and I will, and we will we'll discuss some other things that we can do before first day. But now, first, I'm going to assign you all to a breakout room. So, what topics will you do? That's
Can I make a quick remark?
yes, of course.
The link that's in the individual assignment PDF
Yeah.
doesn't work. So
Okay.
it says the page you requested cannot be found. So
Is that the post-COVID fantasies one?
yeah.
All right. I'll put that on my list, and also, well, you probably can copy paste it, or is it still?
Let's see. Oh, yeah, I don't think it makes any difference, but
All right. Well, I will put that on my list and put it on Canvas today.
okay.
Yeah. All right. I'm gonna create the breaking rooms now and see.
I think it does work for me though. So I've had that before as well in Canvas, but I don't know what the problem is, but I can see the entire file.
All right. Okay. Well, I will check it out and see if I can make it work for everybody, but good to know that it works sometimes, I guess. But I'll put that on the list. All right, I will create like the last 10 minutes or 5, let's say. We're going to come back. But now I'm going to put you all in the breakout room. So see you soon.
Sorry, I have a question.
Yes.
My internet fell out, so I didn't get an invite
All right.
to a breakout room.
Let me see how to put you in a room. Ah, okay. It should work now.
I don't see anything pop up yet. I don't know.
Oh, that's weird. I don't know why this is not working. Like I can see you and I can move you to a room. Like it says that you're in, it says not joined. Maybe, is there anything that you can see?
I only see the Zoom meeting with the 4 people still here.
Ah, okay. I'm not sure how to. Hmm. Maybe like I'm trying to figure it out, but maybe you want to discuss any ideas that you have with me now, not to steal you of.
Well, I don't really have any idea as of yet. It will. Yeah, I don't really have an idea which way I wanted to go. That's why I would like to go into the breakout rooms to see what everyone else has, and then maybe
Yeah, I would like you to go too, but
adapt my mind to it. But if it doesn't work, then I'll just wait 10 minutes. That's okay. It will be discussed anyways.
yeah, well, that's upsetting. I wish I knew how to put you in a room now, but the weird thing is that I see you in a room and I can move you around, but somehow it doesn't make you enter into the room. Still, like, I think I'm gonna try to see if we can maybe collect a list of subjects or something so you won't be too left out. Yeah, I think I have to disappoint you for now. Like, it doesn't give me the option to move you anywhere. It's just, it says that you're in a room actually. So
That's okay.
I'm sorry. All right, I'm gonna go into some rooms myself now. So,
Okay, thank you.
all right. Hello. All of us back. Okay, I'm gonna wait half a minute so we're all all right. Yeah. Just gonna wait for a little bit longer. Okay, I think most of us are here now. You okay? A couple of things to round off the session now. Unfortunately, I was not able to join all the breakout groups, but next Thursday we will definitely have more time to also talk in smaller groups to each other, and hopefully you will all have your idea developed a bit further. There are some main questions that were posed by many of you that I want to discuss now that we're all here. This will take like 5 minutes and then the session will be over for today. So the question was like, how do I start now choosing a topic and addressing the literature? We all know that this course only contains 4 weeks. The lecture's only 3 weeks because the last week concerns examination day. So how to go about that? Now, it is a thing that is kind of like a standard component of this course. So it's always a bit busy and you kind of have to start your assignment early because you do not have 8 weeks and a bit longer to chew on it. But also it has never been a problem in former years and it all works out in the end. But to go on a different pace than an 8-week course is quite vital to complete your individual assignment. Now, what I would suggest, and it's a suggestion, you're free to work however you prefer, is to start with an empirical dilemma, topic of interest, or something that frustrates you that concerns Corona. As we discussed, the Corona crisis is a core component of your empirical essay now. So start there. And let's say I gave it as an example before, you want to do it about lean in innovation in healthcare. You start there and then you can converge and go through the literature, see what literature will be helpful to compose your actual argument. So doing it this way will save you from diverging and first reading all the literature, which is probably that's not feasible to do in a couple of days, but start with what you want to discuss and how you want to position. After that, you can go through the literature and look what will be relevant for your essay. Now, the second thing to that is that what you can do, you can have a very micro topic, very specific topic, and use just the innovation literature to back up how you position yourself. Still, you don't have to be exclusive to one topic that was discussed in the lectures. As we explained, we start off this course with more of the basic theories of organization studies. So you can also use those to complement. Again, if I talk about the example of lean, You can use the innovation literature, but there might also, scaling off the ICU beds, there can be a critique to that using Gadamer's framework and theory of that there is a rationalization of health that sometimes is at friction with nature and the human aspect of organizing health. So you don't have to stick or limit yourself to the literature of one topic. You can though, so that's up to you. Now, a few examples that will be, well, I have 2 more pointers actually, because some people ask, like, we're not sure what we can all do. Well, I would suggest you to be creative and find something that really sparks your interest, because that will always give the best writing in whatever case. But just some suggestions on top of the suggestions that are already mentioned in the document uploaded in Canvas that talks about the guidelines. So a couple of notes that I made myself that you are free to steal from me if you want to. So one first, to start very minor. One thing of debate was that Sinterklaas, for the non-Dutch speakers, the Dutch Santa Claus, let's say, went to an elderly home in the holiday spirits and infected a lot of the people living there, with also causing death. How should that be organized? Is that a friction point of maybe physical health and mental health? You could use that as an example. Tests. There are the testing, like there are tests that tell you if you already had corona or not. Still, that's not included or provided. Do you think it should be better if that would be provided? Who should be vaccinated first? One big topic that we are talking about now, and how should that be organized? The lean beds, I said, last couple of weeks, one of the points of discussion was whether corona patients should always be granted access first to the ICU over regular care. What do you think of that? Is a COVID patient, should he also always be granted a bed first, even though maybe somebody with another disease will have the same odds at not making it? Like, that could be one. What else do I have? One example is to compare how different countries organize around corona, working together. What about if Germany runs out of ICU beds and the Netherlands can take them? How should that go? Etc. etc. These just some examples to get the creative fluids going, I guess. Lastly, and then we're going to stop for today. The only thing that you have to hand in this. Okay, I have a practical question if I stand in no work groups. Okay, the sessions as set on Canvas and the syllabus and the lecture will always be from 10 to 1:45. A bit overdue this time, but next time we'll have no technical issues, hopefully, that will cause that. So yes, from 10 to 1:45, 3 45-minute sessions every time. Yeah? Okay, last thing, there's only one thing you have to hand in that will be graded, and that's your individual assignments. But for those of you who want to, I'm going to give you the option to send your subject to me, email it to me, and I will provide very brief feedback, just a couple of lines, whether you're in the right direction. You can do this. There will be a bit of a time frame. You can do this before, well, let's say tomorrow, 1 in the afternoon, and I will try to give a couple of lines of feedback on hopefully tomorrow or the day after. So my email is this. So this is not mandatory. You don't have to do this. You won't be graded for it. It's just to provide you with a little bit of extra security, or if you have doubts, how to address this process. I would like to ask you to limit it to a small little paragraph. So just the core argument that you want to compose. And I will give you a little green, red light, maybe orange, or maybe a little addition to it, or other thoughts. So you can have a good start with that. Could this be in form of bullet point outline rather than paragraph? Yes, that's fine. As long, but I think, I mean, you're all smart and reasonable people. Don't make it 30 bullet points. I mean, it's a bit of an extra because education is different now, and it's nice to have some extra posts for stability. But keep it in reason, that would be good. So if you do that before tomorrow at 1, if you want to, not mandatory, then you can. All right, I think that's it for today. Is there anything for now that I can help you out with, or any questions? Yeah, there are 2 links on Canvas. That's because there can only be one official host and an alternative host in one Zoom link. So the first one, I think, is the Zoom link that Jannes will use as a host. And the second one is for me for the first 3 sessions. This is because as an alternative host, you don't have all the features of Zoom. So we had to create 2. Clear? All right. No, the examination is the individual assessment. So a question that the course manual states an exam. The form of exam is the individual essay assessment. Yes? No problem. Okay. Any other questions? All right, then I think that will be it for now. I want to thank you all for joining. I'll see you on Thursday. And if there are no technical problems, we will be more timely. But for now, I wish you all a good day and see you soon. And looking forward to seeing some of the ideas and subjects for the essay from some of you. All right. Oh, I hear something. No? Okay, good. All right, bye.